Medicine, or AIM Health Institute, and the GW Office of Integrative Medicine and Health, or OIMH. AIM is a nonprofit organization with the mission to provide access to whole person health and wellness in the greater Washington, D.C. area through integrative therapies, education, and research, with a focus on vulnerable and low-income communities. Please sign up for our mailing list at healthaim.org. You can follow us on Facebook or Instagram, and please kindly consider a donation to help us keep it going and accessible for all people. GWOIMH provides professional development, education, and community outreach to improve health and wellness. You can follow us on Twitter, Instagram, or LinkedIn, and sign up for our newsletter by visiting our website, smhs.gwu.edu/OIMH, or as Janet would point out, you can just Google OIMH and we pop right up. AIM and GW are very happy to offer these experiences for free and plan to keep doing so on Fridays at 2 p.m. Eastern. We look forward to continuing to be present with you each week. So with that, I will go ahead and turn it over to Dr. Kogan.
All right. Today I'm going to tell you a couple of things. So first of all, I'm going to run through some of the medical updates. And then I'm going to give everybody a little bit of a, instead of a kind of a COVID directly, we're going to talk a little bit about fatigue and how to try to optimize it, because both Elizabeth and I yesterday, we were teaching our small class and we both like, we've really been feeling down and realizing that I think the reality of a chronic stressor is beginning to catch up with everybody. So we'll give a couple of ideas that are both, more of a botanicals, but also more of a energy work. So, all right, first update, masks, because I feel like if this topic spills over to every discussion I have on the Facebook, I was called anything, anywhere between that I'm a bad doctor to I'm a complete charlatan if I tell that anybody to take the mask off of the face for a fraction of a second, it means I'm killing them. To, of course, the whole group of people is saying absolutely no masks, they will kill you if you put them on. So it basically looks like, if anything, we can send you a very funny YouTube that basically kind of summarizes this bipartisan complete divide in the country, which parallels the whole, I think, political dilemma that we faced. In short, basically, whenever you are at the risk of any exposure, meaning that you're less than 10 feet away from somebody else, if you're more than 10 feet away and there's no extraneous situations like nobody's screaming or singing or talking very loud, probably risk is none if you're outdoors. And if you're more than 10 feet away in that situation, if you're not expecting to come with anybody close contact, there's no point. Whenever you're indoors, you got to wear something. Indoors means any doors. Yes, public transportation is a door. Large supermarket is an indoor, etc. The gym, etc. However, there seems to be a lot of confusion as to which masks to wear and then what and how to think through this. For most of us who are not directly taking care of COVID patients, N95s are not needed. And this is important. Why? Because N95s are more expensive, and more importantly, they are still in somewhat of a limited supply, and they should really be reserved for healthcare practitioners. So it's really, really essential that you then decide between a standard surgical mask, and I'll explain a couple other things about that in a minute, or you really get yourself a cotton mask and you decide to put inside the cotton mask either an additional layers of a charcoal or anything like that. There are lots of new technologies with masks. I do want to say that. I tried to start following that. There's a copper inlays, there are static electricity inlays, there are all kinds of things. I would say don't over-research this yet. I don't think any of those masks have yet been proven to be more efficacious than, say, a regular cotton mask. So I'd say stay with those if you have a cotton mask. Now, what's the difference between cotton and the surgical? Because that comes up most of the time. The studies that were done are pretty clear that, yes, surgical mask appears to be a little better. They're spread a little less, so meaning that when you have a surgical mask on, amount of droplets that are escaping out of the sides of the mask is less than from the cotton. However, the question is how relevant is it in terms of the COVID, and the data there, it doesn't actually exist. So, and then so if you have an access to surgical mask, there are two types of masks. So one, which is my preferred, are this ones. So as you can see, I have to tie them in the back of my head. Why are this better compared to the loop? Is because the amount of control that I can have over this is a lot higher compared to the loop. So this is the mask that GW Hospital using. They don't have the loop mask. How critical it is, we don't know. But if you can get those over the loops, I would recommend this. Cotton mask, if you can't get this, your next, and your kind of a last option is a cotton mask. So if you already have a cotton, should you switch to this? I say no, unless you're going to have a risk higher than an average, meaning you're going to go to a very crowded places, or you're going to go to a place where there is a possibility of you being exposed to a positive patient. What am I talking about? You're going to go to a facility to do some kind of a procedure test or whatnot, and there's just higher chances that in that medical facility there's going to be somebody positive. In that case, I would suggest you wear this. Now, I am not basing this on any factual information. This is the way I take a look at this, okay? And I think I'll pause that and see if anybody has a mask questions before I move to the other part.
There is one question about quilted masks. Benita read a study saying that might actually be the best.
Yeah, that may be. Again, I haven't seen that specific study, but I'm assuming that's a study of a spread, meaning that they're showing when you cough or sneeze what happens, where do the particles go. The problem with those kind of studies is that they're what's called approximation studies. So you don't actually know if that does translate to a COVID spread being different. You know, so that's really all I can say about that. Yeah, so that's what I'm saying. How about surgical loop mask over cotton? I'd still probably go with the surgical loop, to be honest with you, because they are still going to be a better, probably compared to the cotton. If you have a choice. Now, if you already have cotton, the advantage of cotton, there is a couple of big advantages. So one is they're washable. So especially if those that have a charcoal filter, for example, you just take a filter out, throw it out, put in the replacement, and then wash the mask. You really can't do it with this. So if you're exercising, and when we exercise, we exhale a lot more, and there's a more moist air, and the masks can kind of dampen, and they can get kind of unpleasant to wear. So those you probably want to wash. So you may have a couple of masks so that you have one that you're constantly replacing and washing. With the standard surgical mask, the best you can do is what I do is after I wear them at the chance of exposure, I simply put them away for at least 3 days. They just go away, stored in a bag, and then I reuse them after. But if they soil, I throw them out. I don't keep them. That's the disadvantage of this mask. You have to have a significant supply so you don't run out of them. But they are pretty valuable now, I think, and they're typically somewhere between $2 to $3. That's what I'm seeing on average per piece.
Luen has a great question. Since gyms are reopening now, what about exercising indoors? If you can be 6 feet apart, do you still need a mask?
Yes, absolutely. Remember what I said? Indoor is indoor. Whether you're 10 feet away indoor, 20 feet indoor, 30, I would wear the mask. Why? It's very different from outdoors. The moment you're outdoors, there's a free flow of air that dramatically reduces transmission simply from that fact alone. Once you're indoor, unless you have a very specialized air filtration system, which I wouldn't count on. Like the airplanes is a good example. Supposedly they have a very specific filtration. Frankly, I don't care. If I have if I cannot examine that system myself, I'm wearing the mask. I don't. Plus, I think all of them are requiring now for people to wear masks. So it's kind of the same with me indoors. When you're indoors and there's anybody out inside with you, the mask got to be on, period. So it's just, unless it's your family or somebody you're co-isolating, is that the word? Can't quite, co-isolating with. But other than that, yeah, and then cotton probably, so that's another interesting question. When you do exercise, which mask would be better for the breathing, which would be easier to breathe with? You have to try both. I could easily do mask on doing weight lifts, chopping wood, any kind of high intensity interval, but I absolutely cannot bike or run in those masks. I get sick very quickly, probably, and and maybe it's partially because I'm not gonna drop my exercise speed 3 times. I'm gonna keep heading towards what I usually do, and I feel really awful with them. So I don't wear them. I pick trails or locations where I really come in contact in such a short periods of time, passing people, that I'm not too worried about that. So, and that's my personal take, even though I think the Montgomery County, where I live now, requires that everybody, even outdoors, wearing the mask when they're exercising. So, okay, N-acetylcysteine for crowdfunding COVID. Dr. Heyman talked a lot about it, I know. Maybe not everybody were there. This was many weeks ago now. So N-acetylcysteine is a precursor to glutathione. I personally been taking it now since the day it's all started. I'm a strong believer in glutathione optimization, and N-acetylcysteine as a precursor is adequate. Glutathione itself is very expensive, or much more expensive than N-acetylcysteine. That's why probably N-acetylcysteine is adequate. So very yes to it, especially if you're higher risk than average. And I would probably take somewhere between 600 to 1,000 milligrams per day, or 1,200 milligrams a day. I think that's okay. I have a couple more minutes about, if there's no questions, about fatigue and other things.
There is a quick follow-up question from Luann. She's concerned about carbon dioxide buildup when she's dancing. She feels like she just can't wear a mask when she's dancing, but if she's indoors.
Yeah, so Luann, this now came up everywhere, left and right. So I wish I have a good answer. I feel the same way. Now, I did measure my oxygen. My oxygen didn't drop when I was exercising and couldn't do it. I think a lot of it has to do with the simple work of breathing. I feel that if my air is obstructed, I can't. It may be partially psychological, it may be partially physiological. So I'm not exactly what to tell you. I think if you're indoor, you really ought to wear it. You may want to definitely just stay with a cotton instead of because the surgical, in my opinion, were a little worse than the cotton when I tried. So cotton was the easiest one. One thing is not to do is bandanas, they don't work at all. So don't wear them. There is a reason why the masks are made, so they're enclosing the entire area. If you have it open up here, it's completely unprotected. So the bandanas, and they've done experiments with them, they're completely ineffective. The spread of the particles exactly as if you're just talking. It may be a little less of a distance. It may be cutting on a distance, but it doesn't prevent much of anything. So don't use bandanas. Thank you. 600 to 1,000. Thank you, Claudia. That's exactly right. Most of the capsules come from in 500, 600, and 900 doses. So you can accordingly use it that way. Okay, so in terms of fatigability, there are 2 things I'm going to talk about. Number 1, those of you who've never tried herbs that are called adaptogens, now is a good time. We actually have a Claudia who's a partial expert in this. There are probably other people here who know even more than I do, including Dr. Frame. So, but what I have a kind of my own favorite cocktail. So it includes ashwagandha, it includes holy basil, rhodiola, eleuthero. So those are kind of 4. Now, what you don't want to do without discussing with your provider is taking high doses of any single one, because there could be drug interactions, there could be side effects, so you have to be careful. The lower dose of those, if you're feeling run down, taking them for a few weeks with food is quite safe. Usually, if you get the capsules, and again, several of them, actually would be good to type them up. I don't know if anybody can help me out with that. So that's first cocktail that I really like. The second is it includes Japanese mushrooms. So those are reishi, shiitake, turkey tail, and Meitake. So those are common kind of a 5. There are several others. There's a chaga and others. The company, and I'm going to say this, I think it's fine. I use them. I have no disclosure. I don't have any financial relationship with them. It's called Host Defense. Those of you who have heard Dr. Steinmetz, that's his company. And then, so they have a My Community product, and then I think it's called Power 7. So those are 2 good brands. They are available now. There was a time when they were completely outsold. Now they're seemingly coming back. But there are a variety of really good brands, Gaia, many of them. So for mushrooms, there are even probably less concerns with them. I think very few cause any kind of serious side effects. So if you're taking capsules and you're taking no more than, say, 4 capsules a day, it's very unlikely you're going to cause any problems. And the timing probably, if you want to experiment, would be with both of those. 2 weeks on and then 2 weeks off. And then do it a couple of times to see how you feel. So yes, so Claudia is here, by the way. And I don't know if Claudia wants to type up anything. And we hope that at some point she'll give us much more details on this whole topic. I'm really, I only use a couple of things consistently, but there are people here. Claudia.
Misha, I'm actually going to talk on the 24th, so it's coming right up.
So it's a preview for your talk. So maybe some of our listeners can try some things and then ask you specific questions. But I think it's becoming even more important as we go from this kind of an acute phase to a chronic, where I see now, if a couple of weeks ago, I've had most of my patients coming in with acute issues. Now everybody coming in with a fatigue, with kind of this overrun down adrenal system. I just finished the consult with someone in Europe who's basically husband and wife both had COVID and lasted about 3 weeks. They're in their 30s. And now about 2 months later, they both barely can exercise and they're continuously short of breath. And the fatigue is the most prominent symptom, despite lots of sleep and despite adequate nutrition. So those are the things that we've discussed, and those are the recommendations that I made in addition to some other recommendations. So with that,
we should, move on to the next portion, the actual mindfulness practice, which we are pleased to welcome back Elizabeth Goldberg. I will go ahead and turn it over to her.
Hello, everyone. It's a pleasure to see so many familiar faces and names, and welcome to those for whom this is their first time with us. So I'm Elizabeth, and I teach mind-body medicine with Dr. Kogan at the GW Center for Integrative Medicine. I'm also a massage therapist at Freed Bodyworks, which fingers crossed will be able to open sooner than later. I actually, just as a quick note on masks, I had a massage myself, I think 2 weeks ago, and I wore a mask and the therapist wore a mask, and it really wasn't that bad. It felt very natural, honestly, and I didn't expect that. And I think because when we're wearing masks, we're often like moving or trying to communicate, things like that, on a massage table, you're just literally relaxing and not trying to do those things. And it was much more natural. So a preview for those who may be concerned about what it would be like to try to wear a mask in a relaxed state. So for the last many weeks, we've done our mindfulness exercises, and we've done a lot of guided imagery, so deliberate daydreaming, and it's been very guided within the guided imagery space, kind of dictating what you see on the road and what a tree is like and feeling from the tree, and that's all wonderful and very valuable. I thought today we might try kind of the next level, not left level, but a different type. So more of a passive, creating your own journey. And so first I ask you to do a quick inventory of your body, how things are feeling, where they're at. I'm noticing my shoulders are pretty tight. Didn't know that before. My feet are a little fancy. Is that scan that reminds us that our bodies and minds are not these separate things, but rather an integrated loop. If you have a notepad in front of you, maybe jot down a couple things that are on your mind, and that way you know that they'll still be there when you come back. It's a technique I've started personally. And so, as you're ready, you can sit or move into a comfortable position. I'm going to get onto the edge of my chair here. Feel my sit bones and all four corners of one's feet. Feel your body in its place. And allow your body to soften and just let yourself be. Allow your awareness to move to your breath. Maybe one hand on your chest, another on your belly, feeling that natural undulation, aware of the in-breath, aware of the out-breath. If it feels comfortable for you, in through your nose. Pause at the top and out through your mouth. Breathing in, feeling calm, moving your hands to your lap if that's where you'd like them to be. At peace, preparing to go on a mental journey. So now I'd like you to see yourself in a very special place. It could be a real place, a place you might actually have been, a beautiful spot in nature, or a comforting place in your own home. Your special place may be an imaginary place, a place in fairy tales. It could be indoors or outdoors. Doesn't really matter. Should more than one place come to mind, just allow yourself to stay with one of them and feel anchored there. The only thing that matters is that this is a place in which you are completely comfortable, safe, and at ease. Appreciate this scene with all of your senses. Let your shoulders drop if they've come back up. Hear the sounds, smell the aromas, feel the air as it caresses your skin. Experience the ground securely under you. Touch and feel the whole environment in which you are. Feel activated. Notice what you're wearing. Notice what's on your feet. What time of year it is. What time of day. How old you are.
whether you're alone or with another person or people in your safe, comfortable place. Notice the colors that surround you. What is the temperature? Is it warm, cold, 90 and humid? No, just kidding. Is there a breeze? Notice the quality of this place that make it special, safe, and comfortable. Look around you to see if there's anything else is more comfortable for you. Perhaps something that you need to remove or bring in. And then notice how your body feels in this place. Anytime you need to, come back to the breath. In, out. Now looking into the distance, you notice a wise and helpful being moving slowly towards you. This may be a wise guide you've met before or not, coming in to offer support and guidance. There is nothing threatening about the experience. You are comfortable, safe, and at ease. Begin to picture this wise being who will greet you. It may be a man or a woman, a child, or an animal, a color or presence, or perhaps a feeling. If something that has an age, how old or young it is, large or small. If it's a person, how they are dressed. Most importantly, how this wise guide's energy feels to you. If this person or creature makes you feel warm, safe, comfortable, and at ease, you know it is your inner guide, your wiser self, your spirit guide, whatever name feels right for you. And as the being or presence approaches, greet it as you feel appropriate. You can make contact with it in any way that feels right. Words, thoughts, touch. What are those sensations? Know that this wise being is here to help you and serve you. The wise being may have a message for you. Listen to the message, accept the message, learn from it. Or if you have something you want to ask it, you go ahead. Perhaps some advice you need, questions, a solution. It's possible your wise guide may have a gift for you. Accept it if it's offered. Now spend some important, comfortable time with your wise being. You can always return to your breath. Now, give thanks, knowing you can return at any time. You have already cataloged what it looks, feels, sounds, all of the things, the imagery around you, you'll remember. When you're ready, at your own pace, let your breathing again deepen. Relax your brow. And very gradually, let the awareness of your body in your chair or couch, other space that you're on, let that return. And a gentle observation again. Bring yourself back to this space slowly and comfortably. And when you're ready, think of something or someone who brings you joy. And gently open your eyes to a soft gaze. Okay.
Thank you so much, Elizabeth.
Thank you. I was going to ask that in this moment, we all collectively take a deep breath together, having gone through this together. In, out, sending our energy to those in the world who feel suffering and need healing and support. Thank you. Thank you, Lee.
Thank you, Elizabeth. That's wonderful. So we have time for a few questions. If anyone have any questions for Dr. Kogan at this point, or if anyone wants to say anything about the mindfulness experience we just had, or has any questions for Elizabeth. You can type them in or feel free to unmute yourself as well.
Yeah, let us know.
I have a question for Dr. Kogan.
Go for it.
Go for it.
I bought a mask that has an insertable, it says N95 carbon filter. It is smaller than the mask, but it does cover my nose. It says it's good for a week, and I don't know how to count the week. And then secondly, as an experiment, I tried rinsing it with some dish soap and some water, and it dried like it was new. Can I reuse it?
I'm not sure I'm following. So is it a clothes mask?
I have a cloth mask that's a little open on one side, and you insert a filter that has the shape of the mask, and it covers the area that's from your nose, part of your cheeks and your chin. I mean, up to your below your lips. I mean, so you're breathing through the carbon filter.
Is there any chance you can show it to us?
Sure.
And you'll need to turn on your camera, of course.
Sorry.
So you'll have to turn on
I'll put my video on now. Okay. So here is the mask.
your camera is off.
Oh, sorry.
Okay.
So here's the mask.
Okay. Yeah, that's washable mask.
Yeah, it's washable. So it's 2 layers of cotton.
Right. And then you have a filter that you put inside, and that filter, it says N95. Yeah. Yeah, that's good. That's a good stuff. So those filters, if it says
This is the size, so it's smaller. I have to
okay,
stand it up.
it's fine. It's okay. So you can use this mask in 2 ways. You can use it as a regular cotton mask. If you put the filter, supposedly it makes the mask better. I don't know if there's any evidence for that, but you definitely can do that. I would definitely wash the mask without the filter in, and then you can use that filter.
I'm sorry, it's 2 thin layers, so I feel more comfortable because
Yeah, that's good. That's a good mask. So
okay.
so wash the mask and then use those filters for about a week, throw them out, and then get the new ones.
So washing my filter, even though it looked okay, the same as after washing it?
No, washing the filter, no, you can't wash the filter. They're not washable.
Okay.
You have to throw them out after.
So if I'm only out for maybe a couple hours, do I count that as a day out? And I mean, how do I count my 7 days?
That's a hard question. I'm not exactly sure how to answer it. Why don't you, yeah, I probably would say they're probably wearable for a whole week. So for a whole week of breathing. So you can probably count that as just 2 hours.
That's what I thought, you know, but my week could take a month to go through those outings.
Good.
Okay, thank you very much. Sorry.
That's all right. That's good. Luann is asking, has anyone noticed a speeding up of energy again? Yeah, I don't know, Lou. I feel like it's both ways. Sometimes it speeds up and sometimes it crashes backwards. Everybody, we're having esoteric discussion. Just stay with us. Luann and I do this sometimes. I don't know. A part of me wants everything to slow down, but I think it's a magical thinking. It ain't gonna slow down.
Yeah. Okay. Thanks.
For me, the energy is difficult because I feel like cognitive dissonance between how things are in DC and how they are nationally and globally. And so that to me like seems like almost like an energy block because I can't reconcile those things.
Yeah. Good point.
Yeah, Carrie, I heard about the industrial towels used as masks. I think that's probably fine. I would probably equate them to cotton masks, not to the surgical masks, just by the way they're constructed, but it's definitely better than nothing for sure. And even if you make some at home yourself, so you can make masks from all kinds of materials at home. There are all kinds of online guides and sort of videos how to do it. Just do understand that you probably won't make them as good as kind of a higher end mask, which is okay. All right. Would naps help with the energy? Great question. No, they will not. You should be very careful napping because it disrupts the natural rhythm. Napping sometimes is useful for extremely fatigued and debilitated people, but otherwise, as a regular principle, I say absolutely not. If you're a person who likes napping, you may want to kind of carefully look at your circadian rhythm and decide whether it's actually worth not to do that and move to sleep only at night. It's not an exactly easy question, but as a sort of general rule for energy, no. If you're needing to nap to restore your energy, there's a problem going on, and it needs to be probably addressed with a sort of a trusted provider. That's what I would say.
Should they also look at getting enough sun exposure in the morning, make sure they're resetting their circadian clock?
Exactly right. Thank you, Dr. Frame. That's one of the reasons why you want to get an early bright light exposure. Is part of it is to sort of restore the natural circadian cycle.
Is walking in the early evening at the end of the day when the sun is out equivalent to the morning?
I would say not even early evening. I would say just afternoon, like, maybe between something like 3 p.m. all the way down to 6 or 7 p.m.
I walk around 6 or 7.
Yep, that's great.
I wrote my question, but last week you said that you suggested, I think you recommend or suggest, I don't know which word you used. This is Salome. Those who are 80 years old not to go outside at all.
So, well, no, it wasn't me.
Grocery shopping and so on.
It wasn't me. It's a general CDC recommendation, and in most of the states that people over 80 absolutely minimize any non-isolating activities or going outside of your own house for any reason. There is a reality and then there is an idealism, and the reality is such, especially if you live alone and there's no other way but you need to go get a grocery, well, you can't, so that's when the masks come critical. I say that probably anytime you're not in your house, just wear the mask and do the minimum you can. Now it goes back to exercising or not outdoors. Is that part of the question? Yeah, I gotcha.
Us walking outside and going to grocery.
Yeah, I think you and I are going to have a much longer chit chat next week on Tuesday about that. But in short, I say go outside, just as long as you're not, as long as you're minimizing during transitions that exposure when you're going through the apartment building, like a lobby or places like this. but definitely do go outside and exercise outside if you can, as long as you can assure that you're not going to be crowded by crowds, which hopefully not. But if you were to ask me a gym versus home exercise for you, I'd say home. Actually, I would say for now, don't go to gym. I think until things get a little more settled down in the gyms, or if you have a pretty secure gym in the building that's only a few people routinely go to, and it's not something that's going to get overrun for whatever reason.
No, I do it at home, and I'm not yet 80, but closer. Okay, thank you.
Of course, physical therapies are different because that's a healthcare facility, and they're going to keep a very aggressive measures. So if you've been prescribed physical therapy, of course, that doesn't apply to that. Also, unfortunately, I heard that a lot of big apartment buildings have shut down their gyms completely. So there are probably a lot of liability issues for some of the public facilities, unfortunately. So you can't control those. So yeah.
Do you still recommend the 3-layer mask, cotton, polypropylene, and polyester?
Yeah, and if they're just 2-layer and then they have an insert, what Cecile showed, that's probably okay too. That's what we bought. They're charcoal inserts. That's what kids and Angela wears. I tend to wear more of the surgical, unless I go to, even when I go to store, I would wear surgical. That's just because I have access to them more than that. So, and then if I were to be in a way more exposed situation for a while, let's say an airplane or a bus for a period of time, and I actually am going to wear N95 in those places. But that's partially because, again, I have access to N95. It's the same N95 I'm been reusing now for a long time. The hospital made an interesting exception. They basically said, in contrast to what it's supposed to be, which is about 6 to 8 hours of N95 and throw out, they basically said if it looks intact, use it as long as it looks intact. Now there's no shortage. Nobody does that anymore except me. But I also don't use them that much to begin with. So I probably have no mask that's been in use more than continuous 48 hours.
It's a good question, and I've been wondering this myself. What do you think about going to the dentist? If you've been putting off your routine dental care, you probably want to get in and get that taken care of.
Right. That's critical questions. So I would do 2 things. I'd call your dentist and ask about what they do, and sort of how do they, what's their processes. Meaning, some dentists have decided to work on an alternate schedule, meaning that they're just decreasing amount of hours, and that's just so they can clean between the patients, because this is actually way different compared to some other, let's say a physical therapist, right? Because the dentist is in someone's teeth, and the way of cleaning between the patients is way different compared to, I don't know, Elizabeth's massage therapy or physical therapy place. So I don't actually have a really good answer to that. I was just trying to figure that out for my own patients in terms of what the recommendations are. But here's what they're saying, that probably standard routine cleaning can be delayed. But anything else that includes an actual, like if you actually have a problem and it was said come back in 6 months, that should not be delayed anymore. And you should, if you're really concerned, you need to contact your dentist and get a sort of clarity about the cleaning processes and how they have been running their practice. Not every dentist is back to practice. This is my understanding also. So some dentists are just reopening now. I have one of the dentists I collaborate with downtown DC. They opened last week. So, they're not everyone, but there are some dentists who work through continuously. They didn't shut down at all. So I think you also got to talk to your own dentist to sort of find out there. Where can we get an N95? That's the problem. So do not buy a N95 on Amazon, because you're going to get a junk most likely, and you better just get a cheap cotton or cheap surgical, and don't, because they're probably going to be copycats, and you're just spending extra money for not necessarily true N95. Plus, on top of that, as I said, if your risk is not very, very high, it's not really clear that you have to have them, and they're a lot harder to wear, and it's especially harder to wear them right. Plus, if you truly need to wear them, you also need to be what's called fitted in, which is a process where you go in and you put the mask on, and they give you very nauseous, well, not so nauseous, not pleasant smell, and then you smell it through. And if you can't smell it, the mask is not right for you. And then there's a variety of different N95. So you have to be fitted to find your own fit. So going on a plane in September, yeah, eye exam. So eye exam and dental is exactly the same. So if you're at any risk for any eye disease and your exam is because your ophthalmologist told you need to come back for the screening, you have to do it. If you're just doing it because you have no problem and it's time for your routine eye check, that I would delay. And I would discuss that then with your primary care doctor to sort of when should I go. Question is, where's the photo? I think I said it already several times. This is a Greece. It's a little blue zone where people live long life. It's called Ikaria. Yes, correct. Going on a plane in September. I'm not sure if it's a question or a statement, but good luck. Oh, N95 for the plane. I don't think it must be. The reason I'm wearing it because I have an access and I have an access to the right one for myself. But if you're not fitted, I'd say just wear a regular surgical mask. From Maria, my PCP keep postponing my physical exam. What is accept? I wouldn't worry about that actually either. If it was just a physical exam, just for an annual exam, I would say it's fine. You may want to ask your PCP though to check your blood work because you don't have to go there. You can just have a blood work checked without actually having the exam. And if there's a problem with the labs, then they can bring you in sooner. The other thing is ask them for a telehealth visit. You know, a lot of things can be done on a video and you know, you cannot do exam, but a lot of things can be asked and checked and blood work can be ordered and reviewed and all that. In fact, I'd say probably 75% of all the medicine for the routine things have been switched, if not more. And I'm talking about university. I'm not just talking about private practices.
Yeah. My doctor actually had me put my wanted to watch me walk for balance and other stuff because I have seizures. But anyway, so I actually had to angle my my phone down so he could see my feet going forward. So just an example of how something that one would normally think, oh, this would have to be done in person, we were able to figure out via telehealth.
And there are things that must be done in person. You can't really get your teeth cleaned by telehealth, unfortunately. So there are certain things that just no way. So yeah, we're all gonna have to adjust to that. I think it's a good place to end because
I totally agree. That was really wonderful. Thank you so much, Dr. Kogan and Elizabeth. Probably our most frequent visitors here in this forum. And I want to thank you all for joining us again on this special day, Thursday. And next week, we'll be back to our regular scheduled Friday. You will receive an email with information about this particular one, all the different things we mentioned, as well as information about the upcoming event. Please do register because we want to see you again next week. Happy 4th of July, everyone.
4th. Bye, everybody.